Good afternoon to all. Today's topic Faradic type current, objectives, introduction, modified Faradic current, electrical activities of nerve, accommodation, effect of nerve stimulation, effect of frequency of stimulation, strength of contraction, physiological effect, indication, technique of treatment and preparation of the patient. First, Faradic type current. What is a Faradic type current? So, Faradic type current is a short duration interrupted current. It is a duration of the time 0.1 to 1 millisecond and its frequency 50 to 100 Hz. Faradic type current are produced by a Faradic coil type of induction coil. Current provided by a Faradic coil was a unevenly alternating current. Faradic coil have now been suspended by electronic stimulator. Modified Faradic current. What is modified Faradic current? In this current, it serves A constant from unmodified current, B constant of surging, C duration, and D frequency, E waveform sawtooth triangular and trapezoid. This is the image. A unmodified. This is B in surges. C may surges varying in durations. D is varies intervals between the surges. Okay, and E is the surges varying in wave form to the triangular and trapezoidal. Electrical activity of nerves. Nerve transmission. Nerve plasma membrane creates resting state of nerves termed as a polarized state. Stimulus, PD fall, sodium channel open, and negative outside a positive inside. Electrical stimulation of nerve. So nerve impulses can be initiated by an electrical stimulus. Plasma membrane act as a resistance connected in series with tissue. Surface of membrane near a cathode become a negative. Near the anode become a positive. Anode because of a same polarity as a ECF positive causes a rise in PD cathode having opposite polarity causes fall in PD causes a depolarization of nerve. Cathode work as activity electrode. Accommodation when a constant current flow of a nerve adapts itself. Current which is a rise or fall suddenly is a more effective if a variation of a current is a gradual accommodation occurs. Effect of nerve stimulation on sensory nerve. Downward traveling impulse has no effect. Upward traveling impulse is appreciated when it reaches the conscious level of brain. Long duration causes a stamming and uncomfortable sensation. Short duration causes a prickling sensation. On motor nerve, downward traveling impulse applies causes a contraction of muscle motor point at which a motor nerve enter the muscle, generally generally present at a junction of upper and middle of one third of a fleshy of belly of muscle. For a deep muscle area where they emerge from the beneath the more superficial one. Effect of a frequency of a stimulation. Increasing the frequency of a stimuli shorten relaxation of the time. Frequency more than 20 Hz, the partial tetany, and the frequency more than the 60 Hz, the fully tetany. Strength of contraction, what is that? It depends on the number of motor units activated, which is the turn depends on the intensity of a current and the rate of the change of the current. This is the motor point. Motor point of the muscle is superficial by the facial nerve, frontalis, corrulators, orbulators, oculi, levator upper limb, orbulators, or is the depressions of the lower limb. This is the backward. This is the facial upper branch, facial nerves of the middle branch, and facial nerves of the trunk, and the facial nerves of the lower branch. This is the upper limb, the motor point. This is deltoid anterior fibers, pectoral major, coracobrachiolates, and biceps brachii. This is brachialis and brachioradialis, flexor crapuloradialis and flexor pollicis longus, flexor digitorum, adductors and pollicis brevis. This is abductor digital minimi. This is digital minimi and the flexor carpi ulnaris and the pronator teres. These are the motor points. As you can see, this is all the pointed to motor point. Lower limb, the gluteus medius and minimus, gluteus maximus, biceps femoris, and the semitendinous and the semimembranosus, gastrocnemius, medial head, and gastrocnemius, the lateral head, soleus, the soleus. Okay, flexor digitorum longus, tibialis posterior, and flexor hallucis longus. This is anterior. This is the posterior and this is the anterior. Anterior, what is that? Motor point sartorius and tensor facet later and vastus lateralis and rectus femoris. Vastus medialis, tibialis anterior and pronis brevis and extensor digitorum brevis. What is the physiological effect? So, the physiological effect. First, tissue on the body are capable of the transmitting an electric current. Conductivity varies according to fluid content. Epidermis has a high resistance, 1000 ohm, and superficial layer do not readily absorb moisture. So appropriate measures are used to reduce its resistance. Stimulation of the sensory nerve causes a reflex vasodilation. Erythema, stimulation of the motor nerve causes a muscle contraction. Effect of a muscle's contraction. There is an increased metabolism with a constant increase in the demand of oxygen and foodstuffs. Increase the output of waste product causes a vasodilation, increase in blood supply to the muscle. Exert pumping action on the veins and lymphatic vessels, thus the increase the venous and the lymphatic turn. Chemical effects. Chemical form the come to contract with the tissue. There is a danger of electrolyte burns. Danger is less appropriable with the intermediate current than the constant current. Indication. What is the indication? Facilitations of the muscle contraction. When patient is unable to produce a muscle contraction, contraction induce some flowing events. First, excitations of the small efferent fibers, stretching of a muscle spindle which stimulate primary nerve ending and therefore sends information in anterior horn cell causing excisions of extrafusal muscle fiber. Inhibition of anterior horn cells supplying to antagonist muscle pain has the inhibitory effect. Treatment must be arranged so that the part is a pain-free position. Patient is in caused voluntary contraction at the same time of electrical stimulation. Reduction of a muscle action. What is that? The reduction of the muscle action. Inability to contract a muscle voluntarily may be result of a prolonged disease, as in intrinsic foot muscles a long-standing flat foot. Faradic stimulation may be used to produce contraction and so help to restore the senses of the movement. Training a new muscle action after tendon transplantations or the other reconstruction operation, a muscle may be required to perform a different action from that which is previously carried out. Neuropraxia of a motor nerve. What is that? A neuropraxia of the motor nerve. Impulses from the brain are unable to pass the site of the lesion to the reach of the muscle. Voluntary power is reduced, lost. Faradic stimulation is given below the point of lesion. Submotor nerve. When has been serves degeneration of axon. Paradism may be used to exercise muscle but replaced by direct current as soon as possible begins to weaken. Techniques of the treatment. How to techniques and how to prepare the apparatus. The preparations of the apparatus. Low frequency electronic stimulator is used. Some physiotherapy preferred smart Bristol Faradic coil machine is tested on a physiotherapist. Describe the patient sensation that he will feel. Make sure the patient can see the muscle contractions. If surging is automatic, the duration of frequency should also be tested. Active electrode may be disc electrode or a small length pad with a flat flatted electrode. Pads are the lengths covering the disc electrode are soaked in a warm 1% saline. Corner of electrode should be rounded as the point may causes of the contraction of the current. Preparation of a patient. Clothing is removed, the area of the treated. It is important that the patient warm, otherwise the muscles do not respond to well the stimulation. Part of the treated supportive. The patient may be arranged so the movement is produced when muscle is contracted. For training of a quadriceps, the knee may be arranged in the slightly flexion so the extension takes place. Skin resistance is reduced by washing with soap and the water to remove the natural coils of moisturizing with slime. Broken skin is avoided. Thank you so much.